Good morning. This is Anna May, second semester nursing student. Today is November 30th, 2017, and the time is 11:50. Today I'm going to show to you how to do the physical exam, the head to toe physical exam. First of all, I'm going to knock knock. Hi. Provide privacy, of course, hand hygiene, and then introduce myself. I'm Anna. I'll be your nursing student for today. I'm going to do the head to toe physical exam, okay? And verify my client using the two patient identifiers. Can you state your name and your date of birth?
Tiffany Taylor, 12/27/94.
Awesome. Today I'm going to do, like I said, a head to toe exam. If you have any questions as I go along, please feel free to stop me and ask the question, okay?
Okay.
Okay, let's go ahead and start with your vitals. Okay. Let me go ahead and take your temperature. Your blood pressure. Your blood pressure is 120/80, which is normal.
Okay.
Let me get your temperature. It's 98.5. Let me go ahead and get your pulse. Pulse is 85, which is normal, of 60 to 100. And then I'm getting your respiration. Your respiration is 16, which is good because normal is 12 to 20. Are you having any pain right now?
No.
Okay, awesome. And you know how tall you are?
5'8".
Okay, how about your current weight?
220.
Okay, 220. That's good. Just to check your level of consciousness, do you know where you're at right now?
Lincoln University.
Awesome. The date?
November 30th. It's my sister's birthday.
Oh, happy birthday to her.
Thank you.
And do you know who is the person involved?
Trump.
Trump. Yo, Trump. Okay, now that we got that down, I've determined that you're alert oriented to time, date, and place. I'm gonna go ahead and start the physical exam following a head to toe fashion, okay?
Okay.
Go. Let's first start with your hands. First, I'm gonna check your hands with any neutral swelling or any redness that could be indicative of arthritis. And then I notice that yours is normal. Your nails are normal, no clubbing or anything like that. That could be indicative of chronic low oxygenation in the blood, which is good. Now I'm checking your skin. Your skin is appropriate for your race, which is your Caucasian. That's why you have that skin. And I don't see any abnormal pigmentation or discoloration. Let me check the temperature bilaterally. It's warm. That's good. The texture is smooth. That's good. And the turgor. Let me check the skin turgor. This is just to make sure that you are well hydrated. And I can see that your turgor is plump, which is good. And the moisture is dry. That's good. And I don't see any lesions or anything of that nature. That's good. Check the cap refill as well. I notice that the cap refill is prompt. That means it's less than 3 seconds. Good job. And the nail beds is pink, which is a good sign. Now that I've done your skin, I'm gonna go ahead with your head, okay? Now I'm just gonna be checking your scalp for any possible infestation, maybe some lice.
I hope not.
Which you don't, which is awesome. And you don't, your skin is evenly distributed. It's full. I don't see any sparse or bald area that could be indicative of alopecia. And it's really clean.
I just took a shower this morning just for you.
Oh, good job. You are really ready for this physical exam. Now let me palpate your head or your cranium, making sure that you don't have any swelling or any bruises in it there. Do you feel any tenderness while I'm palpating it?
No.
Awesome.
Feels good though.
It feels good. Good job. Now I'm done with your head. Let's go ahead. Do your temporal pulse. Feel it? Do your temporal mandibular joint. Open your mouth. Close. Awesome. Let's palpate your frontal sinus. Any tenderness?
No.
Maxillary sinus, any tenderness?
No.
Good. Let me test your facial strength. Smile for me. Good. That's a beautiful smile. And then close your eyes. Try to close your eyes while I'm opening, but don't let me open your eyes, okay? Don't open your eyes.
Yeah.
Okay. Oh, good. That's a good muscle strength in your eyes. That's what I'm trying to look for. Then as I'm done with your head, I'm gonna go ahead with your eyes. Okay, if you could, I think that's a good position. Right now, let me start with the visual field of confrontation. Um, let me know if you don't, if you start seeing my finger. Okay.
Okay. I see it.
Understand?
I see it.
Good job. I want you to tell me what number, how many fingers.
I don't see it. There you go. 2, 1, 3, 2, 2.
Good job. Good job, Stephanie. Now I'm done with that. I'm gonna go ahead. Let you do the Snellen chart. We have a pocket chart here that we're gonna just to test your visual acuity, making sure that you can read from a distance. It should be like 14 inches away from you, which let's try if you could hold that. That'd be awesome. Your eye, so about right here. And I want you to cover one eye, read the smallest letter or numbers.
4, 2, 6, 7, 3, 9.
Other side,
4, 2, 6, 7, 3, 9.
both sides.
4, 2, 6, 7, 3, 9.
Okay, good job. That's normal, like especially if we cover our eyes. We normally have that blurry or few
You have
fractions
contacts,
seconds.
so.
Yeah, that's important to note also. And now, what I'm gonna do next is what we call the cardinal position of gaze. We have like 6 points of this. I'm gonna put this in different 6 different points. I want you to follow it with your eyes only, not with your head. Okay. Center, center, to the side, center, to the side, center, to the side, center, to the side, center. Good job. That's really, really good. Now what I'm gonna do next is I'll be assessing the external structure of your eyes. I noticed that your sclera is white, which is good, and I don't see any crusting or any drainage that's coming out of your eyes, which is a good thing. And after that, let me check your conjunctiva. Oh, it's pink and moist. Good, 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 good. Now I'm gonna go ahead and check your pupils. I'm gonna shine a light on this one and then try not to blink, okay? Other side. Oh, good job. I see that your pupils are equal, round, and reactive to light and accommodation. Good job. Now let's go ahead with your ear, okay? I'm assessing your ear. Your ears is normal. It's an anatomical position wise. It's in the right position and it's level to your eye. And I notice no drainage, no redness. And do you feel any tenderness?
No. No.
Good job. Now let me go ahead and check your eardrum and your canal through this otoscope, okay? I'm gonna insert it. It's a little bit, weird kind of feeling as I'm gonna insert it, but just a heads up, okay?
Okay.
I'm just going to make sure that your ear. Since you're an adult, I'm gonna pull your pinna up and back. Good. Other side. Pinna up and back. I can see that your tympanic membrane is in a normal color, shiny, pearly, shiny, and it's intact. That's the most important thing.
Great.
Yeah, both are intact. Now I'm gonna go ahead do the hearing test. What I'm gonna do is I want you to sit here. Okay. Well, I'm gonna be behind you. I'm gonna be whispering something, random letters and word and numbers, and I want you to repeat it for me. Okay.
Okay.
Now cover and wiggle your either which one, which is okay.
HGT.
Good job. Other side.
CHO.
Good. Yeah, exactly what I wanted. Exactly what I put. Now I'm gonna go ahead and do a rhyme test. I'm gonna put this on top of your head and then let me know what do you feel and which part of the ear you feel it, okay? What do you feel?
Both ears.
What do you feel exactly? Vibration?
Yeah.
Okay.
Mm-hmm.
Good job. And I'm gonna go ahead and put it behind your ear and your masseter bone, and then When you no longer hear it, let me know so I can put it in front of your ear, okay?
Okay. I don't hear it. I don't hear it.
Other side. Okay.
So I don't hear it.
I think it's I'm holding it on the wrong side. I should be holding it from here in the stem.
I don't hear it.
What do you hear?
Buzzing or ringing. I don't hear it anymore.
Okay.
Now I hear it.
Okay. You still hear it?
Yeah. Now I don't hear it.
Okay. What I'm trying to look for here is just you're supposed to really hear it as I move it in front because air conduction is greater than bone conduction. So
I still hear it.
Still hear it? Okay, now I'm done with your eyes, ears. Let's go to your nose. I'm checking your nose. I see that it's in the midline, and I don't see any abnormalities in your nose. I don't see any drainage.
Sorry.
Okay, you're good. Let me check your nose as a septal. I noticed that your septum is in the midline. I don't see any deviation. And then your nose pattern, you see? I want you to sniff. Either side. And both can smell okay, right?
Yeah.
Yep. Let's go ahead and check your mouth. Your lips is okay. It's moist. Yeah. Your mucosa is looks healthy. Your teeth are these your real teeth?
Mm-hmm.
Good job.
Forgot to brush this morning though.
It's the same problem I have.
Mm-hmm.
Open your mouth. Your tongue is pink and moist. Wiggle side to side. Good job. I see your hard palate and your soap palate. It's intact. And let me check your tonsils. Stick your tongue out. I see your tonsils is healthy, and I don't see any swelling at all. Can you swallow okay? Mm-hmm. Good. Now that I'm done with that, I'm gonna go ahead with your neck.
Okay.
Okay. I'm looking at your neck, making sure that it's in the midline. It's not deviated, like such in the case of torticollis. You don't want that. And then I noticed that there's no lumps. Do you feel have you had any lumps in your neck? Mm-hmm. Okay. Let me do the cervical. Do you feel any tenderness? Mm-mm. Okay. It's for your cervical lumps. Okay. Let me check your carotid pulse one at a time because I'm not gonna occlude your blood flow to the brain. And you'll pass out. Okay. Now that that's good. I could feel your pulses. Now I'm noticing your pulses here as well, which is a good sign. And then how about range? Your trachea, I can see your trachea is in the midline. And can you do a range of motion for me? Like bring your ear to your shoulder, or side to your neck, chin to your back. Good. Oh, sorry. Good job. Let me do your thyroid gland. I'll be behind you, okay? I'm just gonna be feeling your thyroid gland. Doing that, I'm gonna do that. Can you swallow for me? Good job. Good job, Stephanie. Now that I'm done with, let me go ahead and get this. With the range of motion, right? Okay. Okay, can you do the range of motion for me again? Side to side. Oh, I hear cracking. Okay, now that I'm done with your neck, I'm gonna go ahead and do your I wonder if it's the same. Okay. I'm gonna let's go ahead and get another one. I'm gonna go ahead do your anterior part physical exam, okay? As I'm looking at you, I'm noticing that you're breathing okay. Your breathing is normal, not labored, and respiration wise, it's 16, so you're within normal range. As I'm noticing your skin, it's normal. I don't see any discoloration, and I'm looking at the shape of your chest. It's normal. It's not barrel. like 1:2 diameter. Now let me go ahead and do the precaution first. I'm gonna percuss for any following a ladder-like pattern.
Sit up straight.
Mm-hmm. Sorry.
Nope, you're good. It's okay.
Okay. Good. Let me go ahead and listen to your lung sound. I want you to do the deep breathe for me while I'm doing this. Okay. 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 I think the most important thing here is just I'm following a ladder-like pattern. 1, 2, 3, 4, 5, 6, 7, 8. Okay. Now that I'm done with your frontal part, I'm gonna go ahead and do the posterior part. Here's what I'm gonna do. I'm gonna be inspecting. I'm gonna be inspecting your chest. I mean your back for any the shape, the skin characteristic. So in this case, I should be able to view your back and taking off your clothing. But for this video purposes, I'm not doing that. But I should be checking the skin characteristic. I'm also gonna be noticing the feeling for the lumps and any tenderness. Can you feel it?
Yeah, my back's always tender though, so I have back problems.
Along the cervical spine. Okay, noting the cervical spine also. I'm gonna do the symmetrical, what we call the symmetrical. I want you to do deep breathe for me. Good. What I'm trying to look is that even breathing here, not flail chest or something like that.
Okay.
Now that I've done that, I'm gonna go ahead and do the what we call the tactile fremitus. I'm gonna put the ulnar part of my hand into your back, on your back, and say 99. Okay?
Okay. 99, 99, 99, 99.
Okay, good job. What I'm trying to look for here is the vibration. So I have to do it in 4 parts. Okay? So I have the okay. Then let me do the again the percussion on your back. Actually, this one. Following a ladder pattern. Then let me listen to your lung sound on this back in all lung fields. Okay, deep breathe for me. On the side, other side, couple more. Good job, Stephanie. I noticed that even though you're coughing, your lung is clear in all lung fields. Okay. Okay.
It's my throat.
Okay. Now that I'm done with that, on your back, let me assess your heart. Okay. What I'm trying to look for here is the heaves and trills and lift as I'm palpating it. Okay. Or we could even do it like this, but I'm not. Following the ape to man, aortic, pulmonic, herbs, tricuspid, and mitral.
Sorry, I couldn't sit up.
Okay. And now that I've palpated, I'm gonna listen to your heart tone. Okay. What I'm trying to catch here is in any abnormal heart tones, like murmurs, that's not supposed to be there. Okay, let's start with the aortic, which is in the second right intercostal. And then pulmonic, second left intercostal. Herbs, third left intercostal. Tricuspid, and 4th to 5th intercostal. And then the mitral. Also, I need to actually palpate the point maximal impulse, which is around here. I could palpate that. And then also listen to it as well, making sure that I don't hear any abnormal heart tones that could be indicative of a heart failure or indicative of a heart disease or something. And I notice yours is normal. Then I want you to go ahead and lean back for me. I mean, no. Lean forward as I'm gonna listen to it. Good job. And then the left sternal border. Good job. Now I want you to lay on your left side. I just wanted to make sure that I'm listening. Yeah. That should be the right thing. Ooh. Good. I hear that your heart tone is normal. No abnormal sound that I hear or murmur that's not supposed to be there. Okay, now that I'm done with your heart, let's go ahead with your upper extremities, okay? Let's start with the range of motion of your shoulder. I want you to bring your arms, 2 arms, up, down, all the way back. Good job. Now, like that, abduction, adduction. Okay, good. That's for your shoulder. I want you to do like this and bring your, good job, down. Okay, legs. Supination, pronation. Good job. Now, with that, with your hand, like you're riding a bike, open your fingers, close it. Good job. Now I'm gonna test for your strength. Okay, go. Squeeze for me. One side, left, right, both. Pull me towards you. Push my way. Oh, okay. Good job. Now, I got that. Put your rest like that and try to go up, try to go down. Good job. Spread your fingers. Okay. Good. That's very good strength. Bilateral, your strength are equal. Equal and strong. Good job. Now I'm gonna go ahead. If you could lay back down, I'm gonna check your abdomen. When was your last bowel movement?
Did I have one this morning? I think last night. Or
Okay.
yesterday.
Okay. As I'm checking your skin, I notice that your shape is rounded and non-distended. The skin, it has a few, what do you call this?
Stretch marks.
Stretch marks.
Yeah.
But
Lovely children.
That's for the lovely children you got, right? And then I am looking at your pulsation here. I notice this is more apparent when the patient is a lot more, they're really, really emaciated. Cachexis.
Yeah, you don't worry about that with me.
Yeah. And I'm noticing your umbilicus, it's normal, it's not protruding. And let me go ahead and listen to your bowel sounds in all quadrants, okay?
Okay.
Well, I'm noticing that your bowel sounds is normal. Not hyperactive or hypoactive in all quadrants, okay? Then let me do the percussion. What I'm trying to do here is just trying to make sure that there's no dull sound, because a dull sound could mean an accumulation of fluid, and we don't like that. I'm gonna do a light and deep palpation. And
I'm
then,
very ticklish, just to warn you.
okay, that's good. Thanks for letting me know. Light and deep palpation, and then let me know if you feel any tenderness.
Okay.
Let's start with light. Do you feel any tenderness?
Sorry.
Let's go ahead and do the deep
Oh
palpation.
God. Sorry.
No, you're good. You're good. Apparently, you don't feel any tenderness right now. You're laughing.
Sorry.
Okay. Good. Now that I'm done with your belly, let's go ahead with your lower periphery.
Okay.
If you could just say set up. Oh,
All the way?
yeah. Here. I think you were just gonna leave you like that for a minute. Let me go ahead and do the inspection and the rest of the pulses. Okay.
Okay.
As I'm inspecting your leg, it's symmetrical. Nothing. None of it is higher or lower than the other. It's the same length, so to speak. Um,
Sorry, it's a little hairy.
I'm noticing your skin characteristic and your lower periphery. Good hair distribution. That's good. Even though we have a lot of hair, I think that's good. That means we have a good lower peripheral circulation down there. And I'm checking for pretibial edema. I don't notice anything, which is a good sign. I don't see any discoloration or nothing abnormal on your skin, such as lesions and cuts and bruise or edema or hematoma, those type of things. Then let's go ahead. Let me feel your popliteal pulse. One, I can feel it strong, strong. Bilaterally, let's go down with your dorsalis pedis. Strong, even. It's same bilaterally. Let's posterior tibialis, strong, strong, even bilaterally. And I want you to let me go ahead and do this. Capri feel wise. It's prompt, which means it's less than 3 seconds. Then I want you to push like you're pushing a gas pedal. Good job to your nose. Awesome. And I want you to do the range of motion. I want you to one thing that I forgot. Let's go ahead and do this. I want you to see how ticklish you can get.
Oh no.
Yay! One more. It's a J. It's a J. Good job. Good job, Miss Stephanie. Let's go ahead and sit up because I need to test your range of motion and your lower. Now I want you to try to pull your leg up, down, and then pull it towards me. Pull it towards you. Towards the side. Towards the inside. Other side.
Excuse me.
Other side. Good job. I guess I've checked the edema and lower. Okay, I want you to do the inversion.
No.
Yeah, and towards the other side. Inversion. Okay, good job. Now that I'm done with that, I'm gonna go ahead. What we do, the neuro check. I'll start. What I'm gonna do right now is just to let you identify some of the objects with your eyes closed. Okay. What I'm gonna do is we'll close your eyes. This is soft, and this is hard. Okay. And then I want you to identify it for me and which part of the body I'm touching. Okay. Let's start with your cheek. Yes.
Hard.
Which part of the body?
Oh, sorry. Left cheek.
Mm-hmm.
Soft left. Right cheek.
Okay.
Sorry. Hard. Right arm. Soft. Right arm.
Okay.
Soft left arm. Hard left leg. Upper leg. Hard right upper leg. Soft right leg. Lower leg. Soft right left lower leg.
Mm-hmm.
Soft big toe. Right big toe. Hard right left big toe.
Okay.
God, left and right.
Good job. You did a great job. Now that I'm done with that, I want you to do a fine motor movement for me. Good job. Now I want you to touch your nose and then touch my finger, touch your nose back again, and follow touch my finger. Okay? Good job, Stephanie. I've done that. We'll go ahead and do what we call your gait. I want you to stand up and walk for me, and then turn around and stop there, okay? Just your normal walk. Oh, look at how Tiffany walked.
Mm-hmm.
Stop, Tiffany, and then heel to toe.
That should be fun.
Like you are being stopped in the traffic. Good job. Now turn around, face me. Now I want you to, what we're gonna do right now is a Roomberg test. I want you to close your eyes and stand there. Don't worry, I got you if ever you'll get dizzy. Now the 30 seconds is gone. Good job. Now I've learned that you're pretty balanced. Okay, now I want you to touch your toe for me.
Ooh.
Okay, now while you're doing this, I'm checking for your curvature in the back, making sure that it's in a normal body alignment and it's not deviated like in the case of a scoliosis. And I can see yours is a normal. Good job, Tiffany. That's good. And then after that, I want you to bend your back, okay, and then forward, and then side to side. Turn around like this. Okay, good job, Tiffany. I think we've got everything covered. You wanna sit back down? I just wanted to let you know that I will report every findings to the doctor, and we encourage you to have this yearly physical exam or however the doctor instructed you to. Okay, and I'll probably make a follow-up assessment after this. I'll get you a schedule for that. I'll get you scheduled for that. Is that okay?
Okay.
Do you have any questions? Do you need anything?
No.
Okay. The doctor will be right back, right here.
Thank
Okay.
you.
You're welcome.